Welcome to the lecture for crisis intervention. This is basically an introduction to crisis intervention, talking about some the defining features of crises and crisis intervention, and some of the theoretical aspects of crisis intervention. So, starting off, let's define crisis. And there are multiple definitions of crisis. We're talking specifically here about psychological crises, obviously. But kind of key aspects of most definitions include the things we'll talk about here. One, crisis is considered a time-limited phenomenon, right? And usually we think of a 6 to 8 week period associated with subjective distress, right? And the effects of that crisis may certainly linger for much longer than that, but kind of the intense experience is typically brief. And that's just kind of human nature, that we can't stay geared up indefinitely. We tend to return to some baseline level of affective functioning. Sometimes lower, and that's where we get kind of depression. But nobody stays manic for months and months at a time, right? Unless they have some chemical help. So it's a time-limited phenomenon, as I said, associated with subjective distress, usually emotional distress, and usually the primary emotion is some form of anxiety, right? Either kind of your general anxiousness, or could be fear, or really abrupt periods of fear, which we refer to as panic. And usually, but not always, but usually there's some precipitating event before the crisis. And the precipitating event and the crisis aren't the same thing, right? So losing your job isn't the crisis. It may contribute to a crisis, but crisis is kind of this construct referring to the experience. And it may be caused in part by some precipitating event, but the event isn't the crisis itself. And also the event can be a variety of things, loss, threat of loss, assault, change in role, going off to college, traumatic event, shifts, kind of developmental shifts. Lots of different things could be considered precipitating events for a crisis situation. Crisis is associated with change, right? So it's a change from your typical way of being. And different ways of thinking about that. Some people think about it being going from equilibrium to disequilibrium, right? So you go from some way of being where things in your life, whatever these things are in balance. And crisis is when those things are suddenly out of balance. Another way of thinking about it, slightly different, is disorganization, assuming that kind of we typically function in an organized manner. We're able to, you want to do something, you go do it, and you can organize your thoughts, feelings, and behaviors toward goals. And then whenever your behaviors, thoughts, and feelings become disorganized, you aren't able to move toward goals, desired goals, right? So it's a change from some typical state of being, and you can think of it as moving into disequilibrium. You can think of it as moving from organization into disorganization, depending on just how you like to think about people. And there isn't a right way, there are different ways. This change is a potential turning point, right? And it could be a turning point that's dangerous, that could portend for negative events. So there's this brief period with distress, something happened, you've changed from your normal everyday functioning, and the result of the crisis, the resolution of the crisis, and again, whether or not if a problem is solved or not, there will be a resolution. The crisis will end in terms of your distress will come down. But it could be there's damage afterward, and you have a deterioration in functioning, or a change in functioning that's for the worse. Right? That is one possible outcome of a crisis that's not resolved in a healthful or adaptive way. But the good news is, it's also, as a potential turning point, an opportunity for growth. Right? Sometimes our typical organized approach to the world, our typical equilibrium, how we are every day in the world, isn't that great. There may be somebody who's fairly isolated and doesn't have deep relationships, and some sort of crisis event may push them toward deeper, more meaningful relationships, or may push them toward discovering more about themselves, or may lead to some growth. Think of it from a humanistic point of view, may push them toward self-actualization. Right? There is the potential for that with a crisis. It gets you out of that everyday ho-hum status quo, potentially for the better. And that's where you as an interventionist come in, right? Obviously, we want to get people out of crisis and limit the damage and limit the danger impact. But there's also this kind of positive spin to it that we also want to, as much as we can, take advantage of these times to promote growth and positive change in someone's life. Another aspect of a crisis, it's frequently thought to reflect that the person has insufficient resources and or skills to deal with some problem. And it could be that the person has some sort of normative deficit in resources or skills. So maybe they have a smaller than typical social group. They don't have many coping skills, right? So it could be that they were however they were doing in life, they were kind of lacking in what we would hope most people would be able to do or have, but not necessarily. Somebody could have abundant kind of psychosocial resources and ample coping skills, but still a crisis, no matter how many skills and resources you have, some crises are so profound and so powerful that they can overwhelm anyone, no matter how well prepared they are. Such that no matter how much you have, it's still not enough, right? Potentially. Obviously, the more resources and skills you have, the less likely you are to experience crisis, but nobody is invulnerable to crisis. We're just not made that way. The last thing I want to talk about in terms of defining a crisis is that they're typically idiosyncratic, right? They're individualized, and they're universal too, in the sense that we're, like I just said, we're all vulnerable to crisis. But mostly, for the part that matters to you as an interventionist, they're idiosyncratic, in that no two people will have identical crisis experiences, even if they have the same precipitating event or similar backgrounds. So you could have two identical twins, both in a car accident, and it could impact them differently, right? They could both lose a leg, right? And then after that, they develop a psychological crisis, don't know what to do, and one of them maybe figures it out and applies some skills, and the other doesn't, because they will experience these things uniquely. Right? Which brings me to the first discussion question I want you to post about, and that would be, assume for the fact that you agree with me that crises are idiosyncratic. What's the implication of this for counseling? So, for you as a counselor, what does that mean about what you can do, should do with clients in crisis if they are all idiosyncratic? Okay. And I'll restate that later. Okay. Your book also talks about trans-crisis states and trans-crisis points. These terms are fairly unique to this author, as far as I can tell. They reflect kind of a psychodynamic approach, and they may be helpful to you when thinking about crises, but generally they won't be a point of emphasis in this class. But I will try to clarify here what is meant by the terms that the author uses, just in case you have any confusion. Trans-crisis state is something that happens, that someone experiences whenever they fail to resolve some sort of conflict. And when you think about conflict, it's not that you get in a fight with somebody, it's more that intrapsychic conflict. From, remember, psychodynamic perspective, so id, ego, superego, there's some unacceptable feelings, thoughts, urges, whatever, that you're not able to express fully, and you repress them, you don't deal with it, and that puts you in in a trans-crisis state, which then makes you vulnerable to experience crises. Right? So the implication of this, from a psychodynamic perspective, is that you need to assess people in crisis more deeply than we typically do, and look for kind of repetitive patterns of self-destructive behavior, because you might treat them differently. But you actually would treat them the same as anybody else. There's kind of crisis work initially, but you might treat them differently based on these repetitive patterns if you were to pursue kind of long-term, ongoing treatment with them after doing the crisis work. So, it's about repression of conflicts, as I said, and you assess for repetitive patterns. Trans-crisis points. These are crises that occur following some original crisis event. So you lose your job, and then you find that your car is repossessed. So you have these multiple crisis points related to kind of the same original crisis. The point here is that a crisis increases the risk for more crises. Right? It's kind of the idea that when it goes bad, it really goes bad. Some people say, oh, things happen in threes, or once it's downhill, it's all downhill. But that's what trans-crisis points are about, is that experiencing a crisis puts you at risk for further crises. And you could argue about what that means from a psychodynamic point of view, because you've depleted some of your ego functioning. But again, these terms won't be a point of emphasis in this course. Okay, a little bit of review, just a very brief review of history of crisis intervention. Crisis intervention has, like many things in psychology, a long past and a short history. And by that I mean, crises aren't new things, right? It's not like, oh, in the past 50 years people said, oh, you know what, I just had a crisis. Oh, really? What's that? The first people that walked the earth, whenever they encountered something that they couldn't handle, they more likely than not experienced a crisis. And at some point in time, probably a long time ago, somebody tried to help somebody else who was in crisis. Right? So very long past, but in terms of history, which is about a written record of crisis intervention, not very long. Right? In most people recognize Lindemann's work as the first systematic approach to crisis intervention. He worked with survivors of fire and mostly focused on grief reactions, right, kind of complicated grief. And one of his major contributions in his work was this shift from pathologizing those in crisis, right? Because for a long time it was thought that if something happened and people experienced a psychological crisis where they didn't handle it well, they got upset and they cried and were anxious and maybe even got depressed, that something was wrong with them, that you shouldn't get upset. Right? The whole idea of kind of the English idea of keep a stiff upper lip. And Lindemann said, no, getting upset is a normal reaction to some of these horrible events. Right? Which you would now think, well, why was that a shift? But it was a shift in thinking at the time. Another just kind of note about the history of crisis intervention. If you read a lot of the older stuff in crisis intervention, you'll note, and even some of the newer stuff, psychodynamic theory, the outgrowth of Freud's psychoanalytic theory, has had a very formative influence. Right? It was the dominant theory when crisis intervention work started to come to life. Most of the therapists were psychodynamic or psychoanalytic therapists before the shift to behaviorism and then cognitive behaviorism and humanists and all the integrative stuff we have now. Most people that were therapists were psychodynamic therapists. So a lot of, you'll see psychodynamic terms and psychodynamic thinking woven into a lot of crisis intervention stuff. Some of which is very helpful, makes sense. Some of which seems just a little bit nebulous and not that useful. Okay. The other kind of note from looking back at the history of crisis intervention, agencies that respond to crises. Typically, there's kind of this life cycle pattern of how they're born and grow, and often they're born from tragedy. And when I say that, I mean many of the agencies that we have today that try to help people in crisis were started by individuals who experienced crises themselves, and had no one to help them. And they looked around and said, what the hell? And once they were able to help themselves, they said, well, I want to help somebody else when they go through this. Right? And that's something that everyone acknowledges the importance of anticipating crises and being proactive, right, to use a buzzword, and kind of preventive strategies. But in reality, when it comes down to it, most people aren't willing to pay for preventative services. And that's why crisis intervention services usually don't come to fruition until after something bad has happened already, right? So we don't have a lot of crisis intervention stuff in schools until we have a rash of shootings in schools. And then we have so. As a professional, maybe you can start thinking of, well, what are the things we might see? What are the needs we might see in the next 5, 10, 20 years for crisis intervention? And what kind of things should we try to be ready for rather than reacting to? Okay, let's get on to some theory stuff. A variety of theoretical perspectives can be used to conceptualize crises. We'll take a look at just a few. Psychoanalytic theory, which I think the author here uses interchangeably with psychodynamic theory. And I won't get into a debate about the difference, but we'll use his term for now. Psychoanalytic theory holds that early childhood experiences lead to the formation of a pattern of defenses that will eventually cause a crisis in adulthood. If somebody has a crisis, then they must have had something go on when they were kids that they didn't handle well, or developed defenses to deal with some interpsychic conflict and not in a healthy way, and that made them vulnerable to this crisis they're experiencing in adulthood. Right? And to help someone from a psychoanalytic perspective, you need to get access to their unconscious thoughts, and that's via dreams, free association, or other psychoanalytic techniques. Adaptational theory, as it's described in your text, is really a version of a neo-Freudian theory, Karen Horney's approach to therapy, which suggests that a crisis is the result of maladaptive behaviors and a pattern of destructive defense mechanisms. Right? So the idea that the person is getting in his or her own way, that they're trying to get certain needs met, but they're going about it in a way that's self-defeating. And that this failure to adapt, they're trying to adapt, but doing it in a self-defeating way, that's what leads to crises. And then cognitive theory, which holds that illogical thoughts, such as perceptions, attributions, expectations, any kind of illogical thought, contributes to, so causes and sustains crises. Thoughts like, oh, this will never get any better, or it's all my fault. Something else is bound to happen. Something else bad is bound to happen next. Right? So all these kind of thoughts can contribute to and sustain crises, according to cognitive theory, kind of a cognitive approach. Systems theory, any MFT folks out there will appreciate this, shifts the focus from kind of intrapsychic events in the individual to interpersonal exchanges, right? So that the individual is part of a system, embedded in usually a family system, sometimes maybe just a dyad with a partner, but usually a family system, and even possibly going out from there into larger systems, and that the crisis could be a result of a systemic problem. It's not something that the individual did right or wrong, but something that was malfunctioning in the system, and the intervention then could require working at multiple levels of the symptom. So not just doing individual work, but doing work with the family or with the person's place in work or school or what have you. Related to systems theory is ecosystem theory, which is really system theory on steroids. Right? This goes beyond family and immediate environment to consider larger cultural influences and implications, and even considering proximal and distal time influences. Right? So really drawing the lens back even further than kind of a family systems theory, then you get the idea of ecosystems theory. And the idea that these things aren't just embedded one in the other, but they're related. So you can kind of imagine these connections among and between systems. Okay. Developmental theory reminds us that across time, members of a species are faced with a predictable set of problems, crises, right? Basically, when new experiences demand a different behavior pattern than those previously employed. The classic example would be potty training. Right? For a while in your life, you want to go to the bathroom, you just go. And then you get to a point where all of a sudden the rules change, and now you have to learn not to just go. You have to find this room, sit on this special seat, and go in there. And then you have to wash your hands afterward, which is important. but there are several things, and that's probably one of the most basic. But another one would be, finding a romantic partner is another transition in life. Right? And for developmental theory, applying it to crisis, we can think about each of those things being crises. Right? So failure to appropriately resolve these developmental challenges can lead to crises. Both proximally and distally. So at the time, so if the kid has a problem with potty training, that can lead to a crisis then. If an adult has difficulty transitioning into the kind of the empty nester stage, kids go off to college, it can lead to a transition then. Or we can think about it, the difficulty meeting a developmental challenge leading to a crisis later on. So failure to develop a romantic relationship of any sort during early adulthood. Right? That failure may not lead to a crisis then, but it may lead to a crisis 10, 20 years down the road. Right? So the seeds of the crisis may have been planted in this developmental failure. Interpersonal theory, which as described here, and I say as described here because there are other theories that use similar names, but as described here, it's really an outgrowth of the humanistic approach of Carl Rogers and others. And the assumption is that crisis develops because a person has ceded responsibility for determining their own worth to others. Right? And once the person is able to develop confidence that she or he can control their own destiny and that their own worth is not dependent on others, then the person will be able to resolve the crisis themselves. Right? Now, and development of this confidence comes in the context of a relationship. And that relationship is characterized by unconditional positive regard, empathy, and genuineness. Right? Okay. Chaos theory. It's really best applied to large-scale crises. Makes the most sense in that context. And the heart of the theory in this context is that there's order among the chaos. Right? So chaotic situations will arise, crises, when people are unable to resolve a particular dilemma. And because there are no known solutions, a process of trial and error will be required to resolve the crisis. And because it's trial and error, it seems chaotic, but there is an answer, right? But the answer is unknown, and so there's the appearance of chaos, which isn't that helpful of a theory, except for when everything's going nuts. You can think, well, there's an answer somewhere, and we're going to find it. There's some rhyme or reason to this somewhere. Otherwise, it doesn't guide your thinking all that much. Not that helpful of a theory. Okay. In addition to these theoretical perspectives, there are also multiple models of crisis intervention that are derived from these and other theories. And your text talks about a variety of models, but most of these are mostly really restatements of aspects of the theoretical perspectives we just talked about. So instead of going over those, I want to introduce two other models that incorporate some of the key aspects of the other models, and these are eclectic models, right? So they pull from a variety of theories, and they do so in a systematic way, right? It's not just grab as a grab can, but there's rhyme and reason and logic behind putting these ideas together. But you'll see the influence of other theories and other models within them. The first one is Aguilera's equilibrium model. So in an equilibrium model, it kind of recognizes that we all operate, hopefully, in some equilibrium. Right? We have ups and downs, but they're not major. Right? We all have little ups and downs, all revolving around some hypothetical midline of functioning, of well-being. Right? But then when a crisis occurs, we become out of balance and we experience disequilibrium. And that happens when there are not enough balancing factors present. Right? So the balancing factors in Aguilera's model, one of them are crisis-related cognitions. And Aguilera talks about it actually as perception of the event, but I think crisis-related cognitions is a better label for what she talks about. So I'm going to rename her work for her. But crisis-related cognitions, the way she talks about it in the model, is how you think about the crisis, right? So you can see that cognitive theory here, and maybe even developmental theory too, because how we think versus concrete thinking versus abstract thinking is related to development, and a lot of different cognitions. But one of the main things you think about using this model are, what are the client's explanations for the crisis? What are their attributions? So you can think of Weiner's attribution theory and Seligman's theory of learned helplessness, right? So thinking about things like, does the person have an internal or external locus of control? So something happened, some precipitating event, some bad thing. Do they think it's happened because of something they did or because of something somebody else did? So internal or external. Is the crisis, the thing that caused the problem, something that's stable or dynamic? So is it something that's it's always going to be this way, or did it just happen this one time and it might not happen again? It could change, right? Is it controllable or uncontrollable? So can they do something about it, or is it something that's beyond their control? Unless, is it something that's specific or global, the way they think about it? So, if somebody fails an exam, they think, oh, well, I failed that exam. Or do they think, I am a failure? Right? Same event, two different attributions, different ways of thinking about it. And so those are just some of the aspects of cognitions you could think about. There are a variety of things. But taking into account how people are thinking about the world. And if we're thinking according to kind of cognitive theory, rationally and logically, then we're going to stay in balance. And when we tend to think irrationally, and we use maybe emotional reasoning, we're more likely to become unbalanced and more likely to tilt toward that crisis. Right? And because these balancing factors kind of can put us at risk for crisis, they're also targets for intervention. Right? So something you can do is help people achieve more realistic and more logical cognitions. There's three of these things. The second balancing factor would be situational supports, and whether they're adequate or inadequate. This can be other people in the person's life, which makes you think kind of about interpersonal theory. Do they are people there providing unconditional positive regard and empathy and genuineness? But situational supports can also be economic factors, community agencies. Right? So we're starting to think, okay, there's some ecological theory there. So all the things in the person's life that could possibly help them. Are there enough things to help them there, given what they're dealing with? Right? And it's adequate or inadequate. But the other thing is, you have to remember, situational supports can be good or bad. And generally think about help being good, but sometimes the help can hurt, especially if the help erodes autonomy. So if people are doing something for the client in a way that makes the client feel they cannot do things for themselves, that may not be all that helpful, and that may perpetuate a crisis. Right? And that's a delicate balance, especially in crisis intervention, in therapy in general, but especially in crisis intervention, where oftentimes you have to do some things for somebody. If a building is just falling down around them, you don't wait for them to decide where to go. You tell them where to go. But so you take over and you reduce autonomy in some instances. But we always want to, whenever we can, push forward to restore their own autonomy, because we don't want to be encouraging unhealthy dependencies. Right? The third thing, coping mechanisms would be the third balancing factor. Are they inadequate or inadequate, which kind of draws on that adaptational theory. Remember a little kind of Horney's work in terms of how do they deal with things. Do they deal in an adaptive coping way, or do they have maladaptive coping mechanisms? I'm just thinking about, do you have coping mechanisms or not? Sometimes it's not a matter of whether or not you have them, it's whether or not they're adaptive or maladaptive, right? So somebody that is feeling really anxious about whether or not to call the doctor to see about their test results, getting high, smoking a couple of joints, that's a coping mechanism. It's maladaptive because it doesn't move the person forward. Right? If they go, okay, now I feel better, I'm not going to call, I'm not worried about it anymore. That's a maladaptive coping mechanism. So I think, do they have them or not? And then again, kind of like situation supports, are they good or bad? And when I say good or bad, I mean adaptive or maladaptive, health promoting or health discouraging. Okay. So the other discussion question I want you to post a response to, I have two. I already told you one. The other one is to think about an experience you've had with a client. If you haven't had any clients or can't think of an experience with a client, you can make up one. I won't know. And diagram that crisis basically using Aguilera's model. So make a list, 1, 2, 3. So you have your cognitions, your supports, and your coping. Those are 1, 2, and 3. And under each of these, write down some information about the person's experience. Again, not using anybody's names. I don't want it to be anonymous. Don't tell me the client's name. So, how did they think about the crisis and/or themselves during the crisis situation? What situational supports were present or absent and helpful or harmful? What coping mechanisms were missing or misfiring? Okay, so her model, those 3 things. Talk about some client. What were their? Tell me something about their cognitions, good or bad. It could be, they had a really healthy outlook on it, or no, they didn't. And then tell me about their situational supports, and tell me about their coping mechanisms. Okay. Okay. Now the other model is really different, and I like presenting these two because they're both good and both very different though. Aguilera's model, very kind of conceptual, and then Robert's stage model, kind of this 7-stage model, very practical. Very okay. Step 1, step 2, step 3. Right? Not just how do we think about crisis, but what do you do when doing crisis work? Okay. So stage 1, your psychosocial and lethality assessment. And here you want to obviously do 2 things. So you have a psychosocial assessment and a lethality assessment. For the psychosocial part, it's a psychosocial snapshot, right? You don't have time in crisis intervention to do an in-depth psychosocial assessment evaluation and learn everything about the person. But you do want to find key aspects of who this person is. And when you do that, what things you look for will depend on what theories you're going to pull from. So there's still some room for choice within this eclectic model. Things you might be looking for: what are they doing or using now to cope? Right? Are there any complicating medical or psychiatric issues? Are they currently using drugs or alcohol? What things in their environment are currently supportive or stressful? Right, so you can hear kind of some Aguilera's model in this psychosocial assessment. Things you might assess for include her balancing factors. Right, what's the person's current developmental level? Where are they at in their life? And then the second part of that would be the lethality assessment. Right, so that's where you're assessing risk of harm, both suicidality and whether or not they're potentially homicidal. Are they going to hurt anybody else? And that's kind of the first step. And I'd probably put actually the risk part first. Are they going to hurt themselves, hurt anybody else? Okay, now, what are the key things I need to know about this person? Key things related to how I can help them resolve this crisis and get them restabilized, either reestablish equilibrium or reestablish a sense of organization, get them back to some baseline of functioning. Not trying to solve all their problems in the world, but get them back to some sort of pre-morbid level of functioning. And it'd be nice if you can point them in a direction toward growth. We at least want to avoid that danger part. Right? So psychosocial and lethality assessment. And if we do that part well, we're gonna already have done most of the second part, which is establish rapport. Right? If we do our assessment well, we do therapeutic assessment. Right? So when we ask questions, we don't do it like we're giving them the 3rd degree down at the police station. And if we use our active listening skills whenever they're answering our questions and we don't interrupt, we'll already be establishing rapport. Right? So it's not like ask them questions and then, hi, nice to meet you. Right? The whole time you're working on establishing rapport. You've got to get the information, but if you can do it in a way that builds toward establishing rapport, then you're making your life much easier. But you obviously want to establish rapport. You got to have some sort of therapeutic relationship, some basis of that to do any work in our field. Right? People don't want to work with, listen to, be helped by people that they don't have some connection to. In general, there are exceptions. Then we want to identify the major problems or crisis precipitants. Right? So. And this is from the client's point of view. And usually there's some problem or event that led to a crisis, but not always. They may not be fully aware of what led to the crisis. And there's probably, if somebody's in crisis, they've probably got a lot of things going on. There's probably multiple problems. So you may have to work with them here to help, have them help you prioritize. So what's most important? Which of these, if we're going to work on, is going to take care of some others, and most likely to free up energy for you to be able to take care of some of the other ones. And also, when we're doing this, this should also further strengthen rapport and help the client feel safe enough to do the work that comes next. Right. So now that we've kind of given you a chance to talk about what needs to be done, now we've got some sense of safety, and they've got a sense of purpose, right? Most people, or not most people, some people come in to sessions, and if you just kind of go right at the emotion stuff first, they're like, no, but I want to tell you about this thing. Now, I don't care. I know I feel angry, I feel sad, whatever. Let me tell you about the problem, right? So once they've been able to tell you about the problem, now, again, rapport's been built enough and they've gotten that out of the way, now it's sometimes easier to deal with the feelings and the emotions that are there, that we know are associated with crisis. And again, you want to use your active listening skills, and the goal is to help the client regain some emotional balance. Right? And so it's kind of almost think about like letting off steam, and it's not catharsis in terms of, oh, they'll be all better once they just let out some stuff. But once they let out some stuff, once they vent emotionally in the context of this kind of caring therapeutic environment, this holding environment, right, to use Winnicott's term, it's easier to talk about some other things, and it's easier to think more clearly. Right? And the other thing, while they're doing this, right, you're not just sitting there, and I know active listening isn't just sitting, but even beyond that, while they're venting, you can carefully, skillfully use some cognitive therapy skills to begin to loosen up any kind of maladaptive schema they may have, right? So your client says, oh, it just kills me that things will never get better. Then you can give your response, but in your response you can give a reframe, right? Wow, when you think about the possibility that things might not ever get better, and you won't emphasize those words when you say it, obviously, but I'm emphasizing them for you, you really feel bad, right? So when they're saying things in absolute terms, and you're saying them back in less absolute terms, right? And then, wow, it really seems like it physically hurts to think about that, right? So you're giving them empathy, but you're also correcting or countering some cognitive distortions and offering alternatives that, well, maybe it's not definitely this way. There's some wiggle room here. Okay, now once they've identified a problem, they've vented some of their feelings, and the feelings aren't all gone, but they've taken off some of that pressure, allowed them, given themselves some room, psychologically speaking, to think and make decisions more clearly. Then we can move on to the next stage, generate and explore alternatives. Right? Trying to figure out what to do. And the assumption here is that you couldn't do this earlier because heightened emotionality limits their ability to generate and evaluate alternatives. So you want to, using this model, you want to collaboratively generate potential courses of action. Right? So it's not like now you tell them what to do, but you work together to come up with different things they could do. And those of you familiar with solution-focused techniques, you can use a lot of those here, kind of talking with the client about what's worked before, that kind of thing. And then, logically, the next step will be implementation of an action plan. So choose some course of action, and not you choose, but the client chooses, and you push them to choose, and begin to follow it. Right. The other thing you can do, again, pulling from some other theories here, is help the client develop a narrative that gives meaning to the crisis event. Why did it happen? Which of my expectations were contradicted or violated, and then might need to be revised, right? So maybe the client had some fundamental belief that they were invulnerable, that nothing could ever happen to them, and that may need revision, and not in such that they're vulnerable and bad things will happen to them, but that, yeah, none of us are invulnerable. Something bad could happen. I should live for today, right? I should not put things off that I want to do. Right? And then other things, what parts of my initial reaction made the experience worse, right? And you do that in part to kind of help them develop this narrative that helps with meaning and helps them deal with it, but also so they can learn and they can react differently in the future. Right? If you can build this healthy narrative, it will help them deal with future crises. And the seventh stage would be follow-up, and this is just how are they doing? Were they satisfied with treatment? Again, because this is short-term, but you may contact them later via email or phone, and you might even schedule a booster session. Okay, we're going to wrap up. We're done. You're doing a lot of great work. I think you've got some more work to do, but you can do it without me for now. Let's meet again in a month or in 6 months or at the 1-year anniversary of the event. Right, if it's maybe some tragic event, because feelings will be stirred up by these events, these anniversaries. We know about that. But think and schedule about what you're going to do to follow up with this initial work. Okay, so those are the two models, and you'll notice they're very different. One very conceptual, and one more do this, and this. And you could probably see a way to combine them. I know I could, and I find it a helpful way to think. But overall, for this class, what I want for you, a couple of things. I want you to learn different ways to think about crises. Right? So this isn't a vocational school where you just learn to do stuff. I want you to learn to think about things differently. That way, you can keep learning other skills. And it's not that I want you to learn the ways to think. It's not like, okay, here's the theory, here's the way to think about crises, and you need to memorize this and learn this because this is the way to do it, and I know exactly the answer. I want you to learn some different ways, because the more ways you learn to think about a problem, an issue, the easier it is to learn other things. Same kind of like with language. When you learn a second language, it makes learning a third language easier. You learn a third language makes it easier to learn a fourth language. Right? So the more kind of knowledge you have, the easier it is to build more knowledge. And the more knowledge you have, the more likely you are to be helpful to your clients, which is my ultimate hope for you. Related to that, I want you to learn different skills for intervening in crises, but again, not these skills to use. This isn't a prescriptive course where, okay, when this happens, you have to do this. These are some things that you can do, and we'll practice doing some things. But you won't stop learning crisis intervention skills when this class is over. Hopefully, it'll just be a platform that you can then build on and learn other skills. And some of the things we do, some of the things we talk about may not work for you and your personality or your theoretical orientation. And that's fine. There are lots of different ways of intervening and being helpful, and you have to find what works for you. Okay. Last thing, don't forget your discussion questions. I'll restate them briefly here. The first one that I mentioned was, if it's true that all crisis experiences are unique to the individual, right, idiosyncratic, what are the implications for counseling? And please identify at least 2 implications. Excuse me. What that means to you as a counselor, future counselor. And the second was to come up with an example of a client, real or imagined, in crisis, as described using Aguilera's equilibrium model, right? Those 3 points. Okay, that's all for now. Take care.